I keep doing that.
You better feel it perfect.
Yes, I can't be laughing at this topic.
Good morning, everyone. Thank you for joining us for session 3 of Symposium here in the Commons. We have 4 presenters today. If you have any questions, we ask that you wait until the presenters finish their presentation. For anybody that is on Zoom, you can put your questions in the chat and we will answer those. Other than that, I'm going to turn it over to our first presenter, Alberto.
Good morning, beautiful people. My name is Alberto Perez, and today we're going to be discussing intimate partner violence. So what is IPV? It is abuse or aggression that occurs in a romantic relationship. So this could be past, present, or future relationships. And then from here forward, I'm just going to abbreviate intimate partner violence as IPV. Okay, so there are 4 types of IPV. Physical violence, which is pushing, throwing, slapping, choking, or use a weapon, which can also result in bruising. Sexual violence is unwanted sexual or physical contact or unconsensual sex, also known as rape. Psychological, mind games, verbal threats, exploitation of victims' vulnerability, and defamation of character. And then it's also stalking, unwanted attention, or cyber stalking. And also with stalking, 70% of stalking cases leads to homicide by their stalker. So before I proceed any further, does anyone here know how many IPV, how many people will experience IPV in their lifetime in the US now? 20 million? No. Anyone else want to try? What about someone in the back? No one in the back? It just gets a number. No one? 5 million? Just in the US alone, 81 million people will experience an IPV situation. That is 1 in 4 for women and 1 in 9 for men, or 20 people per minute. You or someone you know could be suffering from IPV. So my research question is, in healthcare settings, does routine screening for intimate partner violence decrease incidence of trauma when interventions are applied? So the next 5 slides, I'll be discussing the 5 journals I based my research on. So in any nursing research, we must figure out if there is a need for this research. That's what my journal 1 is based on. Journal 1 is a mixed method study. Sample size consists of 28,000 participants. Age ranges from 18 to 35 years. The researchers screened IPV in 13 non-traditional sites that include cardiology, dentistry, oncology, and orthopedics. Usually traditional sites that they screen for IPV are women's health or psychiatry and emergency department. They concluded that the highest cases of IPV are in dermatology, otolaryngology, and psychiatry, which represents a need for routine screening in different healthcare facilities based on current screenings in the ED and OBGYN. So this represents a need for routine screening. So my journal 2 is a mixed method study, which I previously stated current screens are usually in women's health facilities, but this one's going to discuss is our current interventions good enough? So the sample size is 6 women who live in New York. The researchers wanted to see if current interventions are effective enough to reduce IPV. During the study, the women used hotlines, counseling, and case management every month. The researchers concluded that victims of IPV are engaged into interventions, but the interventions need improvement because current interventions do not reduce the number of IPV cases, but it did improve the victim's perception of self. Journal 4, sample size 14,000, which only includes 53 men, conducted in the US. The data states that 25.1% of patients who are screened had no decrease in IPV. This is just simply asking the question, hey, are you in an IPV situation? And then 25.1% of people say, yeah, we are, but like nothing changed. So 46.2% who were screened and received counseling had a decrease in IPV, an increase in perception of self, which in other words, they were screened for IPV, they were receiving counseling. So they did have a decrease in IPV situations and a better education and understanding of IPV. 6.2% who were screened and received home visits had a decrease in IPV. So in other words, they're receiving home visits on victims who were experiencing IPV situations. So they did have a decrease in experience. And then 21.9% were screened and received home interventions and had behavioral counseling, which also reduced the number of IPV situations. So these people who are visiting the homes were receiving behavioral counseling, home counseling, and then they were also going to regular counseling. And the researchers also wanted the reader to know that 2,000 participants dropped from the research because of the home visits, because of their abuser, which can indicate a higher percentage in those categories. Journal 5, which is a qualitative study, which means they do it based on the quality of the study. Sample size 49. Wait. There you go. Sample size of 49. The researchers took place at 11 family planning clinics in Pennsylvania, which included 18 providers, 5 administrators, and 23 medical assistants. The staff went through a rigorous training course and education about intimate partner violence. The data concluded that 76.3% of the participants experienced a decreased incidence of IPV, which also initiated the icebreaker discussion from women to women, which resulted to a domino effect. So this research concluded that when they educated and talked about IPV to these women, the women who were the participants of the research started talking to other women, which resulted to a domino effect of those women talking to other women, educating. That was like, hey, this is a real situation. Like, I didn't know I was in the situation. So that was another conclusion from the research. So conclusion, in healthcare settings, does routine screening for intimate partner violence decrease incidence of trauma when interventions are applied? Yes, IPV is preventable. Mandatory routine screening is needed in all healthcare settings. And before the study, most participants were unaware of the 4 types of IPV. Victims with high social support are least likely to report the abuser. Current interventions need improvement, and the best way to reduce IPV is home counseling, behavioral counseling. And then I'd like to share a quote with y'all. It's by the World Health Organization. So the health system can play a key role in preventing and responding to intimate partner violence. So that is the reason why it's relevant to nursing. Identifying IPV in all healthcare settings, assessing patients' physical and psychological health needs, plan patient safety or referrals, provide emotional support, and implementing a safe plan for the patient. And then for the people who are unfamiliar with the nursing process, the process is function as a systemic guide to client-centered care with 4 sequential steps. So assess, screen, assess for IPV, diagnose the nature and context of IPV, plan to make a safety plan or referral, and implement as needed for IPV. And then before I finish, because I see like there's some people here are not in the nursing program. I personally been traumatized by our nursing questions, and I would love to share that experience with you guys. So I have a pop quiz. Question 1, several patients are seen in the emergency department for treatment of various illnesses and injuries. Which assessment finding would create the most suspicion for IPV? The patient who has A, complaints of abdominal pain, B, repeated middle ear infections, C, unilateral bruises on extremity, or D, diarrhea. Don't worry, the questions are fairly easy, said every professor of mine. See, you are correct. Unilateral bruises on extremity. Question 2, a patient tells the nurse, my husband lost his job. He is abusive only when he drinks too much. His family was like that when he was young, growing up. He always apologizes and regrets hurting me. What risk factors was most predictive for the husband to become abusive? A, a history of family violence. B, loss of employment. C, abuse of alcohol, or D, poverty. That is correct. A, a history of family violence. Then this one, I want you to answer, Dr. Anderson. This next one is just for you. Question 3, a nurse in the emergency department asks a nursing student, what are true statement or statements about intimate partner violence? Select all that apply. A, IPV is preventable. B, only women are affected by IPV. C, assessing for IPV is easy. D, ensuring privacy for interviewing the victims away from their abuser. E, there is no psychological damage for victims of IPV. F, stalking is a form of IPV. G, IPV is not real.
Oh, my goodness.
That's why I say on every exam. This is why I want to share this experience with everyone.
Well, definitely D
Okay,
and
F,
F.
that's it? Are you sure?
A and C are a little bit misleading because I believe that you can treat it. And that overall it's preventable, but I worry about phrasing it that way because the victim feels very much like they are the reason for the abuse. And so that one, I'm a little.
And that's also within the education of IPV, because at the end of the day, like I said earlier, that most victims feel alone, but they're not. So that's why we need to open the discussion.
Right. And then assessing, it's easy to ask a question, but there also are a lot of gray areas in that assessment. So I'm a little iffy on A and C. The others I'm confident in.
DF, okay. ADF. You know, because usually with nursing questions, all of them are correct. It's just which one's more correct. Any questions? Yes.
In your research, do you see that there was enough information or is there lack of research for same-sex partnerships?
Yes, so in one of my research, let me see, make sure, I think it was research journal 2. There was a section of people who didn't identify, well, like non-binary, and then but same like heterosexual, yeah, homosexual. No, there was a lack of that. I think I mentioned that in one of my limitations, but yeah, no, most of it was based on women, but it's everyone is affected because most of the time men don't report IPV because men don't experience IPV according to like the general public.
Is there, and this may or may not have shown up in the research, but is there a lack of questioning men by nurses? Like if a man, it's easy for us to ask women.
Yes.
And we kind of stereotype that in our head, but are men asked at the same rate if they're experiencing?
No, they're not. So that's why like most of my research was based on women because I think there was like only I would say roughly overall my research like 150 men. 1,000 max, but men are not asked. That's why most of the IPV questions and screening is in women's health, psychiatry, and the emergency department, but men are not asked as often, but they do experience that because when I mentioned earlier of the 81 million, 39 million of those people are men. Yeah, so it's like about half. Any more questions? No? Okay, thank you.